There is something innately wired within us as parents that always knows when something is wrong. It's most commonly called a gut feeling, and there is some extra special meaning to it, as parents especially. After years of listening intently to moms and dads tell the story of their child's path to an autism diagnosis, I can tell you there is almost always that gut feeling, and they'll report it long before those traditional warning signs that you'll see inside of a doctor's office on a poster tell you these are red flags of autism. These parents know, right? In this video, we're going to discuss all those early signs of autism that have shown up in research articles, and they made their way onto those charts. But even more importantly, we're going to dive deep into the real life stories and signs that parents continue to report to us in our practice today. This is absolutely crucial for you to hear, moms and dads, especially if you've got one of those gut feelings. Here are some of those moments that other parents report to us long before the traditional signs and symptoms of autism even arise. 1, they feel like their pregnancy was overly stressful or emotional. 2, they experience birth intervention, induction, forceps, vacuum extraction, C-section, or a very hands-on delivery. 3, they had difficulty nursing, they had trouble soothing, and they fought to get their baby to sleep all the time. 4, their baby struggled with recurrent acid reflux, constipation, ear infections, croups, RSV, strep, every respiratory illness. And lastly, they had their child on multiple rounds of antibiotics or steroid-based medications in the past. Too often, those gut feelings of concern that these parents have early in the child's life, they're dismissed by the pediatrician as normal childhood illnesses, right? If you've heard the phrase, don't worry, they'll grow out of it, but they haven't, and that didn't sit well with you and your kid's still struggling, then this video is for you. Today, we're going to talk about the most important early signs and indicators that parents can look for, and most importantly, how to put it all together to get your child the help that they need. There's often some major commonalities in the case histories of the kiddos that we take care of that are on the autism spectrum or they're showing signs of early autism. And the vast majority of these kids were born with birth intervention. They struggled as infants with colic. They had the reflux. They're constipated. They did the ear infections and the tubes and everything that came after. They had delayed or even rushed motor milestones sometimes. And they had delayed vocalization and speech too. This is what we're referring to when we talk about the perfect storm. Gabriel is currently one of those perfect storm kiddos who's going through a restoration care plan in our office. He's a 5-year-old. He's got significant speech delays and he struggles with stimming. His nervous system scans, they showed severe signs of dysautonomia and massive amounts of stress stuck within his nervous system. But watching him over these months unwind and develop just this incredible vocabulary has been beautiful. We're starting to see his personality, and it is incredible to watch these results as his nervous system starts to regulate. That's possible for your child too, okay? These early signs and symptoms of autism, they're tracked usually by development related to age, but also by differences in social skills, communication, and behavior. We're not going to cover all of that today, but they center around eye contact, repetitive behavior, lack of emotion, and then struggling to develop speech and communication skills. And so many of these stages of development, they come prior to social, in that communication side, the behavioral side of development, that all happens between 2 and 4 years old. So it's important to look at those building blocks that get the kiddos to that point in the first place. And the 2 main developmental systems that get us there are the motor or the movement system and the digestive and the immune system development. This is often where parents will start to see that struggle before anyone else. Some examples of this would include either holding their head up too soon, like it's too strong, or even too weak, frequent arching or tensing at the back, torticollis and plagiocephaly, delayed crawling or even skipped crawling altogether, delayed walking, continuous reflux, excess spit up, or even vomiting, colic or continuous crying, difficulty in soothing or sleeping, chronic constipation, frequent recurrent ear infections and other respiratory infections, or having to use antibiotics and steroids and nebulizers over and over and over. So with so many developmental systems involved, it's easy to see that autism isn't just caused by a single factor, but it appears to arise from a combination of various factors. And traditionally, autism's been viewed as a genetic condition, but there's been a recent recognition of the environment's impact on it. So not only the external environment, like toxins that we put into or on our bodies, but our food quality and nutrition, and also it's the internal environment that has an impact, or how the physiology within the body is or is not working. So the key regulator of the internal environment is the nervous system by the way of the vagus nerve. And the autonomic nervous system not only regulates those body functions like breathing and digestion, but it also plays a vital role in motor tone, immune function, speech, socialization, and emotional regulation. All symptoms that, when paired, create an autism diagnosis. Combined, these struggles are clinically referred to as dysautonomia, where it's just an interference or a dysfunction in the autonomic nervous system, which is the primary controller of that internal environment. So, why is pediatric chiropractic so important to this? It's simple. It's because it all begins with our focus on that main operating system, the autonomic nervous system and the vagus nerve. Let me make a very important distinction here. We do not treat autism or in any way provide a cure. Our goal is to work to restore balance to the autonomic nervous system by improving that neuromotor tone, movement, and coordination within the body. If a child is stuck in any of those developmental stages or dysautonomia is at play, then even if they're getting all of the other appropriate therapies like PT, OT, speech, ABA, they're on the perfect diet, they're taking the supplements and so forth, they're going to struggle to see results as long as that nervous system stays stuck in that fight or flight and disorganized state. So the key to all of this is going back to development in these important stages and symptoms before kids can go forward with ease and strong function and development. Truth be told, it is hard to add up all the struggles to know where to start, but the key indicators that we just discussed earlier about the nervous system help us as pediatric chiropractors get momentum back into the functions of the body that matter most for development to go forward. For so many parents, neurologically focused pediatric chiropractic care is the missing link that they've been searching for to tie this all together. And the earlier you get your scans and assessment for your child's nervous system, the more confident you can be in the care plan that we're going to lay out to help ensure that your child's health and development are as optimal as possible. We would love to be able to help you. First, please ask any questions or leave a comment below or send us a direct message. Share this with any family or friends that you've got who are in the same boat as you are with the same struggles. And third, check out the link below to the article with more information regarding autism and chiropractic care. If you have any questions, reach out. We're here to help you.